October is Breast Cancer Awareness Month, and this weekend is the third annual Metastatic Breast Cancer Conference. It's going to be happening in Seattle, and we're going to talk about the conference in just a moment. But first, I wanted to go over a few basics with you. Metastatic means cancer has spread to other parts of the body beyond where it started. And when cancer has metastasized, it's also known as stage 4 cancer. And then once the cancer has spread, it is much harder to control. And although there are treatments that can extend a person's life, there is no cure for metastatic cancer. So when you hear someone is living with stage 4 cancer, they will be living with that for the rest of their life. Linda Weatherby and Terry Palastro are both living with metastatic cancer, and they're here today to talk about it with us. Together, they're co-chairing this conference in Seattle this weekend. Thank you both for being here, for getting the word out, for educating us and our audience about what you're doing and your mission. So Terry, I want to start with you. What is the mission of this year's conference?
The mission of the conference is to educate breast cancer patients, both early stage and late stage patients, about new treatments that are out there, things that they can do to make their lives better. And for the early stage patients, they don't realize that they could be us very quickly. And 1 in 3 women will end up, who has had an early stage diagnosis, will be diagnosed with metastatic or stage 4 disease.
So you want them to go get screened?
To continue to be diligent about their care. Just because you're past the 5-year mark, that doesn't mean anything. Cancer can come back 12, 13, even 20 years later.
Okay, wow. So I mentioned a moment ago, you both are living with stage 4 cancer. How does that impact each of your lives? Linda, I'll start with you.
It's hard for people to understand because we look like, you know, your friend across the street, right? But what our real life is going to treatment every 3 weeks, going in for scans every couple of months, brain radiation. I had to have brain radiation earlier again this year as a kind of a recurrence. And we kind of go from month to month getting lab work and tumor markers to see how we're doing and how our treatments are working.
How about for you, Terry?
Yes, I have treatment every 3 weeks, and that does run my life a little bit. You know, if I travel or something, I have to make sure that I come home, or I want to be home. I just like to have my treatment here. And it's always there. It isn't all of my life, but it's definitely a piece of my life.
Are there things that each of you cannot do physically because of the cancer?
There have been times, definitely, when you're in the middle of treatment, when you're compromised.
Right.
And many, many patients are more compromised than we are right now. But fortunately, right now, I'm not living with that.
Okay. Well, it's important that people are aware of what you all are going through, and also that this conference is happening this weekend. So if they're going through it themselves, or they have a loved one who's battling, that they can learn more. So talk to us about what we can expect, what you want the outreach to be this weekend and beyond this weekend, this month, this year. Linda.
Well, most importantly, we're trying to bring metastatic breast cancer forward as kind of, it's the most important piece to solve in breast cancer land. And the number of deaths per year in breast cancer hasn't changed in 30 years, despite a lot of awareness campaigns. And it's because we haven't solved metastatic breast cancer. That's the one that unfortunately takes people's lives. So the more we have conferences and events like this, the more the general public starts to understand. Research will be funded as awareness grows about this is the thing we need to solve. For our conference, we can still accept registrations by phone for anyone who wants to come, and we are going to be live streaming it. So for anybody who wants to stay home and watch the live stream, we have tons of great information and researchers. You can go to the website, I think probably click through from your website and watch it at home all day, Friday and Saturday.
Okay, well, I thank you for being here and for helping educate all of us. Good luck this weekend and with both of your health.
Thank you.
We're thinking of you and pulling for you.
Okay, thank you.
And the Northwest Breast Cancer Conference, as we mentioned, is Friday and Saturday. It's at the Amazon Event Center in Seattle. You can register in person, or like they said, it's going to be live streaming. For more information, go to q13fox.com. I'll put all of the additional information there for you.